this time of year, you are probably seeing ads for Medicare Advantage plans nearly every day, and you might be wondering what the difference is between plans that advertise an HMO network versus a PPO network. Medicare Advantage plans offer you the same Part A and B services as original Medicare. The primary difference is that you will use the plan's network of providers when accessing your care. The two most common types of networks found in Medicare Advantage plans are HMOs and PPOs. First, let's talk about HMOs. HMO stands for Health Maintenance Organization, and it's a type of managed care plan that emphasizes coordination of benefits and cost-effective healthcare. In an HMO network, you will typically choose a primary care physician who becomes your main point of contact for all of your medical needs. Whenever you need medical attention, you'll start by visiting your PCP. They will provide routine care, make referrals to specialists if needed, and coordinate all of your treatment. One important note about HMOs is that they usually have a restricted network of healthcare providers, meaning that you must seek care from doctors, specialists, and hospitals within the specific HMO network. Going outside the network might not be covered at all, except in emergencies or with prior authorization. Because of the restricted network, many of the Medicare Advantage HMO plans are able to offer you a zero or low cost monthly premium. We often see that many Medicare HMOs can also have lower maximum out-of-pocket limits, which can benefit you if you have a year with a lot of medical care. Now let's go over PPOs. PPO stands for Preferred Provider Organization. Unlike HMOs, PPOs generally offer more flexibility when it comes to choosing your healthcare providers. With a Medicare Advantage PPO, you have the freedom to see any doctor or specialist you prefer, whether they are in-network or out-of-network. In-network providers have negotiated contracts with the PPO plan, offering discounted rates to you. So you'll want to treat with providers in the network whenever possible. However, out-of-network providers are still covered, but you'll often pay more to see those providers, and you have to ask if that provider is willing to bill the Medicare Advantage plan. Most Medicare Advantage PPOs will not require you to choose a primary care physician or obtain referrals from that physician whenever you want to see a specialist. This flexibility can be important if you prefer having more control over your healthcare choices, or if you plan to travel and need to see providers throughout the United States. PPOs generally have higher premiums and deductibles compared to HMOs. The increased cost is due in part to the added freedom of access provided by the plan. While HMOs and PPOs differ in their approach to healthcare management, you will still have all parts of Medicare Part A and B covered. When selecting your Medicare Advantage plan, it's important, as always, to first verify that your doctors are in the plan's network and that your medications are included in the Advantage plan's formulary. Choosing your next plan can be daunting. Let us take the worry out of that and make this process easy for you. We will review each step with you and help narrow down your choices until together we find the right plan for you. You can reach a Boomer Benefits agent at 817-249-8600, or for more information about how Medicare Advantage plans work, see this video next.